Thank you everyone for joining. We'll begin in just a few minutes. Good afternoon, everyone. Thank you for joining us today. On behalf of the American Heart Association's Long Island Go Red for Women movement at Mount Sinai, South Nassau, welcome. Today, we're going to listen to questions from the heart, COVID-19 and women's health. In a few minutes, Dr. Pilar Stephen-Haynes and Dr. Sherry Magala will discuss what COVID-19 has taught all of us about being resilient and having a strong heart. Just one reminder before we get started, please type in any questions or comments that you may have in the chat box. We would like you all to participate and engage in our post-presentation Q&A. Alrighty, now without any further ado, thank you all and take it away, Dr. Pilar and Dr. Sherry.
Good morning, everybody. I'm Dr. Sherry Magala. I am a non-invasive cardiologist at Mount Sinai, South Nassau. I work both in the hospital and in an offsite Mount Sinai Doctors of Belmore. And we are happy to introduce and talk about this topic, COVID-19 and women. So we have a few goals that we're going to talk about during this talk. So we're going to talk about COVID-19, a little summary and its effect on the heart. Long-term effects of COVID. We're going to talk about COVID and pregnancy. We are also going to highlight the different ways the COVID-19 pandemic has affected women worldwide. And we'll talk a little bit about the vaccine. So the medical effects of COVID-19. So the coronavirus is an RNA virus and latches on to different tracts in the body. Typically latches onto the respiratory tract or the GI tract and can cause different symptoms, as we all know. Most common is cough, fevers, chills, shortness of breath. Muscle aches is very common. People do get pneumonia. If it latches onto the GI tract, you can get nausea, vomiting, and diarrhea. It can attack the eyes and cause some kind of conjunctivitis. Commonly, the hallmark of COVID, but it does not happen in everybody, it can cause a loss of taste or a loss of smell. That is the only symptom that does not appear in other illnesses. And so if people do have a loss of taste or smell, it's like a pathognomonic for COVID-19. Worst case scenario, people do can get very sick from COVID and can cause respiratory failure, pneumonia, can end up in the intensive care unit. You can get can affect the heart and cause inflammation of the heart, and it can also cause heart failure, which is a weakening of the heart muscle. It can cause strokes, blood clots, and kidney failure, and God forbid, even death. So the long-term effects of COVID, once people do recover, is a lot of people do have these chronic symptoms, and some people recover right away, and some people don't. Some people it takes weeks to months to even recover. So the long-term sequelae sometimes is shortness of breath when walking. People get very winded when they're walking, and we see this a lot in patients that are coming to see us now. Because they still have symptoms and they don't know if it's from the COVID or they don't know if something else is going on. They don't know if it's if it's from the heart. They can also develop chest pain. Typically that's from the pneumonia because when you have fluid in the lung or an infection in the lung, you can develop chest pain as well. But it can also be from an inflammation of the heart muscle as well. People also can get palpitations, and this is actually very common. You can get, you feel like your heart's racing either at rest or when you're exerting yourself. We have like runners that say, I used to run 3 or 4 miles a day, and now I can only run a mile, and I feel like my heart's racing. So you do recover, but it just takes a while, like a few weeks sometimes. The loss of taste and smell is huge. Sometimes it doesn't recover immediately, and sometimes it does take weeks to even months to recover. That's a big thing. A lot of people do suffer from that. There is also a loss of focus and poor stamina. A lot of people feel once they've had COVID is that they're just unable to focus on either their schoolwork, if they're children, or adults just can't focus or can't seem to get through the working day. They just feel, exhausted. And it affects, some of the brain functioning. And fatigue. Fatigue is a common symptom. People get tired, can't get through the day, and it's a very common effect of COVID. Good morning, everybody. I'm Dr. Pilar Stevens-Haynes. I'm the Director of Cardiovascular Imaging at Mount Sinai Heart at Mount Sinai, South Nassau. It's a pleasure to be here. And so continuing with what Dr. Megala said, one of the most interesting side effects of COVID, or the most interesting population that was very easily distinguished early on in the pandemic, was what was happening with our COVID-19 patients in pregnancy. Some of the earliest reports reported a higher incidence of ICU admissions, mechanical ventilation, and even death. And it was particularly alarming because pregnancy occurs in young, healthy women, usually with no comorbidities. It's not a population that you would expect bad outcomes in. And so when those patients were matched for same age and sex, by being pregnant alone, they were more likely to require ICU admissions and actually die from COVID. And so it became a quick population that was easily identifiable and very much in the public view. many of the COVID-19 patients early on in pregnancy were also our healthcare workers. We have pregnant nurses, pregnant physicians, and so it became very, very concerning on how we're going to manage and protect those patients. And so we'll talk about the effects of the vaccine later, but that became a particularly worrisome population. And so initially there was a lot of debate whether or not they should even be working with such patients or how we would best protect them during the COVID pandemic. And so when you look at healthcare workers in general, over 70% of healthcare workers are women. And so this was particularly a disease that affected our women population and our healthcare providers. The early studies from Spain and Italy identified women healthcare workers as being 70 to 75%. And usually the workers include anywhere from nursing all the way to housekeeping. So there are a very, very broad spectrum of providers from the physician level all across the board. And so this includes laundry, housekeeping, nutrition, nursing assistants, nurses, healthcare providers, and physicians. And all of us were considered essential workers, with very few people in leadership and managerial positions. And so this was opposed to the average of about 20 to 30% of our male counterparts. And the expectation was to report to work. And so this created a very, very high strain on women that had the responsibilities of home life and being considered an essential worker and having to mandatory report to work at the time. Most people, when they did surveys at this time, reported high levels of stress and frustration in terms of the lack of flexibility with regards to their work schedule and the pandemic. So before the pandemic, women did nearly 3 times as much of unpaid work and domestic work. Now, since the pandemic, with school closures, it really stretched our women in healthcare and what they were able to do. There were over 1.5 billion children at home during the pandemic. And the stresses that accompany that, the lack of childcare, internet access for remote learning, for those of us with younger kids having to supervise the remote learning at home, created an extraordinary burden on usually the women in the household. And as a result of this, studies show that many women left their jobs. They were unable to adjust their work schedule due to lack of flexibility, and they had to be home. That was the mandate across the nation. And so unemployment actually rose in women from 2.7 million before the pandemic to 11.5 as of April of last year. The effects of staying at home also affected our children, right? There was a rise in teenage pregnancy, a rise in reported of STDs, untreated STDs, as people were afraid to come to the doctors. Worldwide, we saw an increase in child marriages, genital mutilations, and sexual sterilizations across the world. And there was a real fear across the world of leaving school and not being able to return. Another interesting effect of the COVID was that when you looked at who was actually dying from the virus, it turns out that men were much more likely to die than women. And so across the board, when they looked at France, China, Portugal, Spain, Italy, men were dying at a rate of about 70% as compared to women. So this led to another increased stress that we don't really consider sometimes about what it takes to be a new widow. So now I have women healthcare workers having to be at home and support child remote learning, and the possibility of having a husband or a spouse in the ICU or being newly widowed. And so you can imagine the amount of stress that this creates in the home, and the feeling of just being unsupported and where you can go from here. So those studies were done according to the World Health Organization. 70% of ICU cases were men, and over 57% of death were men. And it may be linked to higher associations with being central obesity, diabetes, and smoking. But those are the strongest correlates that they found in terms of death related to men versus women. And so, again, with the stress that is associated with that, being at home alone, underemployed, leaving jobs, financial strain, trying to take care of your children creates a huge burden, almost like a pressure cooker, it's reported. And so another thing that we were looking at, Dr. McGall and I, when we looked at what was happening across the world, was that there was also an increased risk of violence, according to women. Most people reported an increase, most countries, about a 30% increase worldwide in violence for all of the reasons that we just stated.
the financial insecurities and stress, the cramped living conditions, no outlet to go to. Everything was deserted. You couldn't even take your kids to the movies. So really cramped living conditions and closed living conditions where you may have had an outlet before. There was really no outlet as of March of 2020. And so a lot of people reported just being isolated with their abusers. And it was disproportionately affected lower socioeconomic classes of people.
There was also an increase in poverty and food insecurity. COVID-19 will push about 88 million to 115 million people into extreme poverty. And by 2021, it's estimated to push 150 million people into extreme poverty. Now, what is really extreme poverty? It's really living on less than $1.90 per day. Which, when you think about it, that's nothing. I mean, going to lunch and getting lunch is like $10 ordeal. So living on less than $1.90 per day is pretty horrific. In 2018, 1 out of 7 children were food insecure, and from the pandemic alone, it's estimated that 1 out of every 4 children are food insecure. So poverty and food insecurity have risen dramatically with COVID-19, and you can see if it's affecting the children, it's affecting the whole household, and the women as well. So how about the pandemic? How has that affected people in general? It's a big problem. People are home. They are quarantined at home. And when it first came out, we were like, okay, it's not so bad staying at home for like 2 or 3 weeks, a month. Let's clean the whole house. Let's go through every drawer and kind of do some spring cleaning in the late winter to early spring. And it kind of seemed nice that everybody was working from home, and we were able to kind of get things done at home. But after a month or 2 months, you can see how exhausting it is to be at home. You lack the social support. You're not speaking with people from work. You're not moving around. You're not going to the train station. You're not going up those stairs that you usually do. And so obviously it leads to weight gain. So in the beginning, we called it, me and Dr. Haynes, we called it the COVID-15. It was the 15-pound weight gain over those 2 or 3 months. And now it's like turned into the COVID-30-pound weight gain. So being sedentary and being at home for so long has led to a lot of people gaining weight and not exercising. And then you're on the computer working from home. If you're able to, you're working from home in front of a computer. And obviously that's not exercise at all. And when you're working from home, you're also working longer hours because there's no disconnect between home and work. When you're at home, you're working. And so there's not that disconnect the 9 to 5. Now now they've realized that, well, we can kind of get more out of you when you're home and you're more productive. And so many jobs are demanding more. So there's also increased mental and emotional stresses from the pandemic. People are afraid to leave their houses. People are afraid of getting sick. People are afraid of their family members, and they're also worrying about their family members. And that constant worry and mental stress really takes a toll. And then when you're socially isolating at home and you're not seeing anybody, that even, people that don't even have anxiety, it causes anxiety. It causes anxiety, and it's caused a lot of depression, mental health problems, and anxiety disorders. And people are putting their health on hold, unfortunately. The AHA put out an initiative. It's called Don't Die of Doubt. A lot of people were putting their health on hold, and they, when they were having signs of a heart attack, they were actually not calling 911. And people were dying. People were dying of heart attacks at home just because they were scared to go to the ER because they did not want to get COVID. So you're scared of one thing, but then you end up dying from something else. If any, it's important to know the signs and symptoms of something going, a heart attack or stroke. And if you do have any of these signs or symptoms, chest pain, severe chest pain, severe jaw pain, severe fatigue, the signs of stroke. There's an algorithm for FAST. Any kind of neurological changes, confusion, slurring of the speech. The faster people get to the emergency room, the faster they get treated, and the better the outcomes long term. And Mount Sinai South Nassau put out an initiative called "Don't Put Your Health on Hold." In terms of, it's important to get your outpatient screening. It's important to get to go see your cardiologist, your general doctor, to get your well checks, because without these appointments, there are a lot of things that can be missed. I had a patient that everything kind of got delayed. All the appointments got delayed because it was when we first we kind of put all of the outpatient services on hold when COVID first broke in March and April. And my patient was, he was delayed getting to the cardiologist. He was very short of breath, and turned out once he came in, his heart was very weak, and he had a very tight valve. And it took a while, but we were able to fix everything, and now he's doing so much better. But just don't put your health on hold. Don't delay. One of my other patients has been coming to the office frequently, even during the pandemic. And she also has heart failure, and we managed to get her on all the right medications, and now her heart failure symptoms dramatically improved. She says that she's like, I feel great. Everything was great. And actually, we repeated an echocardiogram, and her pumping function, came back to normal. And when I called her, I said, I have to tell you something. And she's like, I hope it's not bad news. And I said, no, it's good news. Actually, your heart function is back to normal. And she was so happy and incredulous. So really, don't put your health on hold. It's important to get your screenings done, your mammos done, and if when you need to go to the emergency room, you need to go. You don't want to put that on hold. The hospitals, yes, thank you, Dr. Haynes. The hospitals have put into their security in the hospital. Basically, there's areas in the hospital where the COVID patients are, and the rest of the hospitals are COVID-free. And so there's a mandated mask. Anybody that walks into the hospital, even getting any kind of procedure or testing, has masks on. Anybody that goes into the ER and that gets admitted gets COVID tested. And so there's the hospital. All the hospitals basically have put out ways to, make it safe for everybody to come in. The outpatient sites, there's masks that are mandated. Everyone's wearing a mask. It's very safe. We clean everything. Everything is wiped down a bazillion times. And we're hoping to bring visitors back in the coming weeks as the COVID rates are continuing to go down. We'll talk a little bit now about, we talked about the traumatizing pandemic, and now there's hope. There's hope with this vaccine. And there's more than one vaccine. There are a few vaccines out there. The number one vaccine is Pfizer, then Mrna came shortly thereafter, and then Johnson & Johnson is being looked into getting approved as well. So what are the purposes of these vaccines? These vaccines are basically priming your immune response. So your immune system is like little soldiers fighting in a battlefield. And so when COVID tries to attack your body, your immune response is already primed. And so the warrior is already in place, and they'll fight the virus quickly and efficiently. Some of these vaccines, the Pfizer and the Mrna, are mRNA vaccines that contain tissue from a virus that causes normal cells to make a protein that's unique to the coronavirus. And when the cells make the protein, the body destroys the mRNA and makes antibodies to fight this protein. And that basically you're augmenting your immune system. So when COVID is around, your body's ready and able to fight. Most COVID vaccines, except the Johnson & Johnson, do need a booster shot. So typically the Pfizer is after 3 weeks and the Moderna is after 4 weeks, mostly to get the most effect. Usually after 2 weeks of the first dose, you do see some, there is some immunity already, but you get the full amount of immunity after a booster. And this is not unheard of. We've had booster shots for other vaccines before. The Tdap is a booster. You need a booster every 10 years for the tetanus, diphtheria, and pertussis vaccine. It's important for everybody to get vaccinated basically when they're able to get vaccinated. So who really shouldn't get the vaccine? I get this, we get multiple phone calls every day. Doc, should I get this vaccine? Should I not get the vaccine? Basically, I tell everybody, everybody should get the vaccine. Unless we have 70 to 80% of the population getting the vaccine or having some kind of immunity, we're not going to be able to put this vaccine. We're not going to be able to conquer the vaccine, and the rates are going to keep rising. So who shouldn't get the vaccine? This is from the CDC. So patients really that have had severe allergic reaction to any ingredient in this mRNA COVID vaccine. Now, people are going to be like, well, I don't know. And the true answer is really, we don't know. So I tell people, if you've had an allergic reaction to the COVID vaccine, then you can't get the vaccine again. But if patients have said, well, I've had a reaction to the flu shot. And I asked them, well, what kind of reaction did you have? Oh, I had like some mild fever, chills. That's not an allergic reaction. That is supposed to, that may happen sometimes when your body is priming itself to fight any kind of infection. So it's not like the flu vaccine gave you the flu. It's basically the flu vaccine priming your body to mount that immune response. So when you have a fever, it's your body mounting an immune response to whatever was infected. It's recommended that everybody should get it unless they've had a severe allergic reaction to the specific type of vaccine. There is a subset of patients that are, there's something called polyethylene glycol and polysorbate that is in the mRNA vaccine. And they think that this may be causing some of the allergic reactions that people are getting, the anaphylactic reactions, which happen within a few minutes. This is what they're concerned about. And they're saying basically that patients that have allergies to this PEG or polyethylene glycol and polysorbate is if you've had an allergic reaction to that, you should not get the vaccine. Polyethylene glycol is an ingredient of the mRNA vaccine, but polysorbate is not. But if you've had an allergic reaction to either or, they recommend not getting the vaccine. And I talked a little bit about reactions, and it's important to know that so anaphylactic reactions are reactions that happen right away. Happens usually within 15 to 30 minutes. And that's why a lot of, whenever you're administering the vaccine, they have patients waiting there and monitoring your symptoms, making sure you're okay before you leave for a few minutes. Those are anaphylactic severe allergic reactions, and that's basically the ones that they're talking about. There are side effects sometimes from the vaccine. People do get different types of side effects, a sore arm from the injection site, some fever, some chills sometimes. But a lot of those symptoms kind of go away shortly after the vaccine, usually within a day or two. And usually the symptoms happen after the second dose of the vaccine. And what about pregnancy in the vaccine? This is a hot topic. The ACIP, which is the Advisory Committee on Vaccine Immunization Practices, recommends not withholding the vaccine for pregnant or breastfeeding women. Obviously, these vaccines were not tested in pregnancy. Usually pregnant women are a protected group, and so vaccines aren't initially tested on pregnancy until much later. And so that's where the hesitancy is. So it's important to discuss with the patient and the physician. And obviously there's different risk categories of pregnant patients. And, I think they're recommending it, especially more if you're a pregnant healthcare worker. But all of these talks have to be discussed with the OBGYN and your doctor.
Wow, that was just excellent. And we want to invite Dr. Stevens-Haynes and Dr. Malaga, if you can turn on your cameras and come on the screen. There you go. Welcome. That was just such an informative conversation, and we want to thank you for taking the time to do that. We know how busy you are, and taking the time to be able to record that so you could really put a lot of energy and thought into it. We promised our viewers that we were going to have a quick Q&A, and I'd love for us to take a few minutes to answer some of the questions. The ones that I received the most is this one. If someone is experiencing symptoms of a heart attack, is it safe to go to the hospital? And I'll let Dr. Megala to lead this one.
It's definitely safe to come to the emergency room. It's very important not to put your health on hold. There was a high end, as I discussed earlier, there was a lot of people that would not come to the emergency room. And unfortunately, some people did die because they were having a massive heart attack and thought that the emergency room was not safe. So the emergency room is safe. There is, if you have any kind of severe symptoms, definitely come to the emergency room.
Excellent. And Dr. Steve, you really brought a lot of information in your presentation that we probably for that. Some of the questions that I am seeing in the chat box do talk about women in pregnancy or who are planning or near or now planning to become pregnant. So what advice do you have for moms who might have some issues around or concerns around the coronavirus vaccine?
That's a great question. There was a lot of concern when the vaccine first came out, and pregnancy is considered a vulnerable population, so it's not a population where vaccines are studied. And so there was a lot of concern about what the effects would be of the vaccination on fertility. Most of those rumors have been dispelled, but I would encourage anyone who has any concern to speak to their OBGYN. I've been having discussions almost on a daily basis with my patients about whether or not they're candidates, what are the concerns about getting the vaccine, which vaccine they should get. And so I would just encourage any conversation to be had with between the patients and their OBGYNs. But to date, there has really been no proven evidence of infertility with any of the vaccines.
I think in the beginning of the coronavirus pandemic, we started to see the connection between not only the lungs, but the heart. What happens to the heart during the COVID-19 virus, or what does the virus do to your heart, and how does the heart recover?
So there are a couple of things that happen. Oh, I'm sorry. Go ahead.
I'm sorry, Dr. Megala, do you want to answer that one?
I'll
sure.
start, and I'm sure Dr. Megala can add a little bit as well. We've seen lots of effects from the COVID virus. A lot of the initial concern was because of all of the hypercoagulable state that patients were in, the clotting. And so we were very concerned about many heart attacks, many strokes, massive heart attacks. We've seen lots of different arrhythmias, some relatively safe, just a rapid heart rate as your body's fighting the infection, to faster and more dangerous arrhythmias. Dr. Megala mentioned earlier in her talk, we've seen a direct effect on the heart muscle in terms of muscle weakness and actual heart failure. For my personal patient population, I'd like to say, and Dr. Megala can add as well, most of the patients that I've seen in my office months afterwards have had partial to complete recoveries. Dr. Megala, I don't know if your experience has been different.
I agree, Dr. Haynes. So I think we had originally thought that it would affect the heart more. And what we were seeing was that we were doing a lot of echocardiograms, which are sonograms of the heart. And we were seeing that, it wasn't affecting the heart as much as we had thought it was originally. And it probably is affecting the heart microscopically because a lot of pathology reports do show that it does affect the vessels and the heart muscle microscopically. But overall, patients that do have some kind of heart problem from the COVID, it's usually the fast heart rates. Sometimes they can get a weak heart, but that's rare. And, when it does happen, these patients are extremely, extremely sick. So it is rare, but it can happen.
And doctors, what do you say to patients who want to get the vaccine or one of the vaccines that are available, who have not been able to yet because of shortage of vaccines?
I think that the vaccine is certainly the rollout was very confusing and doses were scarce. We're seeing an influx of doses now. I would encourage anyone to reach out to their primary care physician, certainly their cardiologist. Mount Sinai South Nassau has access to the vaccine. So if you're a patient within our institution, calling us and we can review the candidacy with you and schedule you for an appointment. But the vaccine will become more and more available. As in terms of which kind of vaccine you can get, we've seen mostly Pfizer and Mrna on Long Island. And I just encourage anyone, whichever one is available. For me, the main difference was a storage issue. They're both mRNA vaccines, and I don't really think that there's much of a huge difference that would warrant someone being offered one and then waiting for another one to be offered.
Right, and then just to tag along, I think the Johnson & Johnson vaccine is a one-shot deal, and it is going through approval currently. And so it may be any day now, it might be tonight or tomorrow that they'll approve it. And then once it gets approved, there'll be more doses available. And even within the last week or 2 weeks, there have been many more doses available. And so if you've tried a month ago and you couldn't get in and you kind of just gave up, I would suggest you try again, because now a lot of the pharmacies have availability and there's a lot more sites that are opening up that do have the vaccines as well.
Well, thank you both. And I think the phrase that we're hearing more and more is that there's light at the end of the tunnel.
Yes.
So
agreed.
I think we have time for just about one or two more questions. And I do want to talk about disparities. That's something that comes up often, and it came up in both of your presentations. So why do you think some communities, for example, communities of color, have suffered so extensively from heart disease previously and now COVID as well?
I think it's probably multifactorial. I think there are a lot of diseases prevalent in Black and Brown communities that not necessarily are not prevalent in other communities, but they're just more so. And so when you look at statistics, African Americans and Latinas are more likely to suffer from diabetes, 2 to 3 times more likely to suffer from obesity, hypertension, COPD, or asthma. And that puts you all at increased risk for heart disease. And as well, if you look at the people that didn't do well when they were exposed to COVID, it's exactly that population. Then you look at certain communities like Elmhurst, Queens, where Dr. Megala and I both actually trained, and you look at living conditions and you deal with multi-tiered families in one apartment. And so this virus swept through entire families where you have grandparents, mothers, fathers, aunts and uncles, babies all in one house and everyone getting infected. And so the ability to isolate yourself in certain communities when you're living in certain conditions is impossible. They don't have big houses to isolate in basements. You're living in an apartment. And so it just becomes much more difficult to control. And I think that's why we saw the explosion that we did in certain communities.
Well, thank you, Dr. Stevens-Haynes. And I think the last word, or the last thing that I would like to do is give you an opportunity to share a last word. Today is actually our last working day of American Heart Month. And so to all the women and really the men who love the women in their life. What message do you have to share with us?
My message is to treat your heart good, exercise, eat healthy, make time for yourself. I know we always keep saying the same thing over and over again, but make time for yourself. Now that, you know, spring is around the corner and hopefully the COVID numbers are starting to go down, you know, go out for a nice walk and kind of treat your heart good and just make time for your mental self also. Get that, you know, pedicure if it's safe, or just do something for you just so that you you can maintain mentally sane during this pandemic, and know your numbers and exercise and eat healthy.
It's the little things. Thank you so much, Dr. Megala. How about you, Dr. Stevens-Haynes?
I would echo what Dr. Megala said and just also encourage people not to be afraid, not to miss opportunities for routine screenings, mammograms, colonoscopies, coming in for your stress test. All across Long Island and New York, we've been very, very careful in the hospitals in terms of making it a safe place for people to come. And so I don't want anybody to miss a health condition, miss a heart attack because you're scared to come into the hospital. Please know that we're doing the very best that we can to protect you. And I also, my second point is to please strongly consider the vaccination and speak to your doctors about that.
Important messages, and what a great way to wrap up American Heart Month. Thank you both. And on behalf of the American Heart Association, thank you all for attending today's webinar. A special thank you to Mount Sinai, South Nassau, along with Dr. Sherry Megala and Dr. Pilar Stevens-Haynes. We want to remind you to please save the date, March 24th, for our Go Red for Women digital experience. Thank you all. Have a great weekend, and please take care of yourself. Bye-bye.